they circulate in very, very little quantities. So any disturbance in that small quantity can cause hormonal imbalance. Puberty is getting earlier and earlier. Now we are seeing the same type 2 diabetes in children who are as young as 14 or 15 years old.
Why are women more prone to thyroid?
Hypothyroidism is much more common in women. Women, they tend to suppress their emotions a lot. They're stressed out. They can't express themselves. They do all the work. They take all the responsibilities, and they don't have any arena to vent out. So that recent research has.
Stress affects menstrual cycle?
Yes, stress definitely affects your period cycle, your menstrual cycle. Number one, that PCOS is only about irregular periods.
Okay.
That's one. Number two is that only obese women have PCOS. And third will be that women with PCOS are infertile. These are the three biggest myths. That is not normal and that doesn't happen. So that's absolutely, it's the name suggests it's crash.
Okay.
So you should not do it.
Is PCOS reversible? Hello and welcome to OTV English podcast. Today we are going to dive into a topic that affects women of every age. So what is it? You probably guessed it right. Yes, it's hormonal health. From irregular periods to PCOS to thyroidism, hormone affects every aspect of a human being's life. It concerns a lot of aspects of a human life that we might ignore just as normal. To help us understand this complex topic, we have among us a very reputable endocrinologist, Dr. Sweekruti Jena. Welcome to the podcast, ma'am.
Thank you.
Thank you for joining us.
It's my pleasure.
So, ma'am, my first question would be understanding the basics. Okay. When it comes to hormones, we usually address it as mood swings or some other thing, but they affect every aspect of our life, as I mentioned it earlier. What exactly are hormones and why are they so crucial, especially for women?
Yes. So if I speak in medical terms, hormones are chemical messengers. And if I simplify it, for example, I need to speak to you. So I message you or I call you. So similarly, the different organs in our body, they're connected by these chemical messengers, which are hormones. So they circulate in very, very little quantities. So any disturbance in that small quantity can cause hormonal imbalance. As you said very rightly, hormones are important for all the functions in our body. Whether when you're a child, it's for your growth, it's for your brain development. In your teenage, it's for puberty. And once you're, in a reproductive age group, for fertility, for your bone health, for your hair, your skin, your muscles, your functioning, entire functioning, your mood swings, as you said, for everything, hormones have a role to play.
So, diving further into it, my next question, hormonal issues are so common these days, especially affecting young women and even children, pre-puberty children.
Yes, that's true. It's mainly because of lifestyle changes. So yes, genetics do have a role if you compare over the decades. So puberty is getting earlier and earlier. You see younger girls, I see in my practice younger girl as young as 6 years, 7 years old having breast development, 8-year-old girls having periods. So yes, puberty is becoming more and more earlier these days because of lifestyle changes, mainly because of, sedentary lifestyle, increase in obesity, increase in junk food, ultra processed foods, which have so many chemicals, so many preservatives. So these things, what they do is alter your hormonal axis and they can lead to early puberty. Also, there is a subset of patients or children that have delayed puberty. So, obesity and processed foods, these are the main, and sedentary lifestyle, these are the main, reasons why puberty is deranged in this group. And if you talk about young girls, adolescents, teenagers, or even girls in their 20s and 30s, you can see that PCOS, polycystic ovarian syndrome, which is irregular periods. So that is also very common nowadays. And all of it is attributed to this change in lifestyle.
So, ma'am, we often see women talking about health issues related to hormonal imbalances, the particular term. At what age do these hormonal imbalances exactly begin? Is it pre-puberty, after puberty, pregnancies?
So hormonal imbalance can begin in any age. So there are certain conditions which are like disease conditions, That can start at any age. But you talk about especially reproductive hormones or hormones which are like for important functions like cortisol, which is stress hormone, or insulin, which is important for, even glucose functioning, etc. All these things can be deranged at any age. It's not, just like anybody who's in puberty or an adolescent or a teenager. Now we see a lot of endocrine disorders in younger children. If I give you an example, diabetes was something, type 2 diabetes was something that we saw especially in the 40 plus age group, you can say. Now we are seeing the same type 2 diabetes in children who are as young as 14 or 15 years old, especially because of increase in obesity. And also, if there is a genetic risk, that is a family history is positive, you can see it in such young children. Thyroid disorders, hypothyroidism, you're seeing in even younger children. There is a certain subset or a certain fraction of patients who have congenital hypothyroidism, that is genetic. That is something that we keep aside, but also autoimmune hypothyroidism is so common in young children. So all of these derangements, it can start at any age. So it's not like it'll only happen after a age or after, crossing a certain age. It's nothing like that.
Ma'am, as you have said about these things, when should people know exactly that something is actually wrong hormonally with them?
So that's a very broad question, because if you talk about hormones, there are multiple hormones in your body that can cause multitude of diseases. But if some of these symptoms, like lack of sleep, fatigue, easy fatigability, lethargy, mood swings, weight gain, or excessive weight loss. So these are some of the symptoms that can maybe, give an idea that you may have an hormonal imbalance. Irregular periods, infertility. So all these things are also there.
So, women are often associated with mood swings. Okay. Women often are seen as very emotional creatures because of the mood swings. So, how often are mood swings related to hormones?
See, more often than not, even normally, in a normal menstrual cycle, which is of normally 28 to 30 days. So this cycle has ups and downs of estrogen and progesterone. So even as a woman, you would feel it that during some periods in those, some days in that cycle, you do feel a little more annoyed than usual, a little more exasperated than usual. So sometimes your hormones do speak to you, and that's normal. I think everyone goes through those phases. When it becomes excessive on a continuous basis, those feelings come repeatedly, and it's not something normal. So that is when you should feel that maybe mood swings are getting too much to handle. In some periods of the cycle, hormones do fluctuate a bit and females do become a little sensitive, but that does not continue for long. It usually happens in the mid-cycle period for 1 or 2 days, and then it normalizes. I cannot generalize it for everyone, but usually this is what happens.
Right. Why are women more prone to thyroid?
So thyroidism, when we talk about thyroid disorders, you should know that broadly we have hypothyroidism, where thyroid functioning is reduced, and hyperthyroidism, where thyroid functioning is excessive, and there can be thyroid swelling. So these are broadly the three things. This swelling can be benign, non-cancerous or cancerous. That's another thing. If you're talking about the functioning of the thyroid, see, a thyroid is this butterfly-shaped organ which is there here in the front of your neck, and this is like a battery or a dynamo. So that controls the metabolism in your body. That controls a lot of things. So when there's an imbalance, if there's thyroid hormone is less, the thyroid hormone secretion is reduced. So there is weight gain, there is mood swings, there is lethargy, everything slows down. For example, similarly, if there's excessive of thyroid hormone functioning, the extreme happens. The excitement level, anxiety, everything increases. The battery overfunctions. There is weight loss, there's increased sweating, there's heat intolerance, the patient feels very hot. So these are the extremes of thyroid function. Hypothyroidism is much more common in women. It's not like men can't suffer from hypothyroidism, but it's much more common in women, because the most common cause of hypothyroidism is autoimmune hypothyroidism. So autoimmune diseases where your body itself, acts against some cells of your body. They have some genetic predisposition, some genetic causes that cause this, and environmental causes as well. Now it is seen that recent studies have shown that women, they tend to suppress their emotions a lot. They're stressed out. They can't express themselves. They do all the work. They take all the responsibilities, and they don't have any arena to vent out. So recent research has shown that women are more predisposed to autoimmune disease because of this factor. and I don't know how far it's true or how scientific it is, but yes, practically we do see that in real life. So autoimmune hypothyroidism is much more common in women, and you should be careful of the symptoms, and I feel that at least once a year we should do a thyroid profile test. That is quite useful. It's a very basic test and can be done in any lab. And some symptoms are like increased hair loss, weight gain, your skin becomes dry,
Yeah, I
constipation.
was actually getting there. That what are the key symptoms of hypothyroidism and hyperthyroidism?
Yeah. So as I said, increased hair loss, dry skin, lethargy, irregular periods, constipation, weight gain. These are some of the symptoms of hypothyroidism. And as I said, hyperthyroidism is the opposite end of hypothyroidism. So there's weight loss, there's anxiety, nervousness, there's tremors, there's palpitations. So the entire body is charged up. So that is hyperthyroidism. Hyperthyroidism is not as common as hypothyroidism, but still patients should know what is the difference between the two.
Thyroid issues cause weight gain or weight loss, or anything related to weight is mostly related to thyroid.
See, weight gain, it is a interplay of multiple hormones. Thyroid is one of the hormones. There is cortisol, there is insulin, there are multiple other hormones. Thyroid is important, but one more important hormone is cortisol, which all of you commonly know as stress hormone.
Right.
So what it does, it increase in stress hormone. It also increases your craving for food, and especially salty food, sweet foods, junk food, basically. So what it does, it increases stress eating. So that increases a cycle again of, vicious cycle of increased craving, increased eating that leads to weight gain. So that is stress. Stress is equal to increased cortisol, is equal to increased eating. Stress eating is equal to weight gain. So cortisol is also one of the important hormones that induces, increased weight gain.
Okay. And about weight loss, it's the same thing?
See, weight loss, again, pathological or disease conditions that cause weight loss. If you talk about hormonal disorders, it is mainly an excess of thyroid hormone excess. There's nothing like if cortisol reduces or your stress reduces, you will lose weight. That is not there. Losing weight, if you're doing it mindfully, if you want to lose weight, that depends a lot on your diet and lifestyle. If you're doing it unmindfully, then you should be careful of certain hormonal disorders like excessive thyroid or uncontrolled diabetes. That also causes weight loss. These are two important causes. And then again, there are other causes, medical causes like infections like tuberculosis or other some infections that can cause weight loss, or malignancies, cancer. These are causes of extreme weight loss. But if you talk about hormones, the two important hormones here in play are cortisol and thyroxine.
Okay. So, is there any food that we need to eat to have a proper thyroid health, to be precise? Or is there anything that we need to avoid when we have either hypo or hyperthyroidism?
So, I think a balanced diet is must to prevent any disease, not just thyroid disorder. Any other disease, a balanced nutritious diet is good. If you're hypothyroid, there are some, superstitions or myths that you should not take cabbage, cauliflower, broccoli, soybeans. So I don't think there's, you can't stop it completely. You can have a little amount. You can have it cooked. Eating raw or an excessive amount of these foods can interfere with your thyroid function. For hyperthyroid, there's no such, limitation. Good treatment will help in a good weight gain in excess thyroid hormone.
When people get their blood tested and it proves that they have thyroid, they have this conception that most of the people, that they do not take medication immediately, under this conception that once they start the thyroid medication, they have to take it for the rest of their lives. So is it true that they have to take the medication for the rest of their lives, or is it possible that the condition can be reversed?
So I see a lot of patients who ask the same question to me, and the ultra health conscious patients who want to avoid the medication as much as possible.
Yeah.
So what I tell them, see, thyroid, if you're having hypothyroidism, the thyroid medication that we give you, it's just it's like a supplement. It's a replacement for the hormone that is not being created in your body.
Right.
So it is like a replacement. You don't have to think that it's a medication. And it is important for the functioning of your body. If your, reports are such that you need the medication, you will be prescribed the medication. There are some patients who do have a transient hypothyroidism. They usually, some of them, a very few percentage improve. But most of the patients, sadly, they progress to permanent hypothyroidism. There is slowly, as I said, it's mostly autoimmune. So the antibodies are attacking the thyroid cells. So it's progressive. So the medication has to continue in most of the patients. And hyperthyroidism, they have to take the medication. So whether it's medication or we have some other modes of therapy as well, that will be decided by the endocrinologist in case of hyperthyroidism. And hypothyroidism patients, who are like 90% of the patients of thyroid disorders are hypothyroidism, they should remember that medication is, it's just a substitute for the hormone that is not being created. They should not consider it as a medicine or something, external to what they're taking for their body.
Right. So people should take medication when they're prescribed, and these are the myths.
Yes. So I do not prescribe it if the, endocrinologist will not prescribe it if it's not required for the patients.
Right.
There are a subset of patients who have very mild hypothyroidism, who can, with a little lifestyle change or with follow-up, we can just manage the patient without medications. But the patient who actually needs the medication, you should take it.
Periods or menstrual health, because that is one of the major concerns among women these days, especially young women, because some of them face irregular periods, sometimes they face heavy bleeding, and all of these things that are part of menstrual health. So I would like to ask you a few questions related to that. And my first question, how irregular is exactly too irregular?
Yes. So a normal cycle duration, it is between 21 to 35 days. As I said, 28 days is the average, plus minus 7 days. So if your cycle is within that period, that's largely normal. So if you're having excessive bleeding, you're having clots, excessive crampy abdominal pain, so that is a red flag, even if your periods are regular in intervals. That's one thing. And if, there is absence of period or amenorrhea, as we call, for at least, 2 to 3 months, there's no accepted cutoff. But if periods have stopped for 2 to 3 months, there's no other reason why the periods have stopped, then you should, take a consultation. Irregular periods, as I said, 21 to 35 days is a normal cycle. So anything less than 21 or more than 35, that's irregular periods.
Okay. So is it possible that stress affects menstrual cycle? It affects periods, the delays, or sometimes women experiencing early periods as well?
Yes, stress definitely affects your period cycle, your menstrual cycle, because as I said, the hormones cortisol and some other hormones, they also affect your reproductive axis hormones.
Right.
A lot of girls must have experienced this in their life. If you have a tough exam or you have a tough event coming which you are stressed about, somehow you have your periods early, or you would have just finished your period 7 or 10 days back, you again see some spotting. So that does happen in some females, and that's okay. That's, if it's not happening repeatedly, it has happened once in a blue moon, you can attribute it to stress usually.
So related to this, we also have many women suffering from PCOS and PCOD. So what exactly is the difference between PCOS and PCOD?
So the terminology, earlier it was PCOD, polycystic ovarian disease. So as the terminology suggests, ovary, as we know, ovary, the reproductive organ of females, if it has multiple cysts in it, which we see by ultrasound, that is called polycystic ovarian disease. A lot of people have this misconception that it is a reproductive disorder, but actually it is a hormone metabolic disorder. So it is not just limited to the ovaries. So it can be associated with other metabolic disorders like obesity, cholesterol issues, can have diabetes, borderline diabetes or frank diabetes, and also hypertension. So these metabolic components can also be a part of polycystic ovarian disease. Hence it was termed as polycystic ovarian syndrome.
Why are so many young girls these days diagnosed with PCOS?
So yes, PCOS is very common nowadays, and it's the most common reproductive disorder in middle-aged young women. 25 to 45 age group, this is the most common disorder. See, most commonly, as I said, repeatedly, because our lifestyle is changing, and this derangement in the hormonal axis is because of that, change in lifestyle, increase in stress, and absolutely, no physical activity, just simple mindless scrolling, and easily available foods are always there for everybody. These are some of the reasons why PCOS is more common. So one more myth that is there, that PCOS only is seen in obese women. So no, obesity, yes, PCOS is common in obese women, and also PCOS causes weight gain. So these women have it, you find it very difficult to, lose weight. But it is also seen in lean and thin women.
Okay.
So it is like a derangement in your reproductive axis. So there is a hormone that we call LH and FSH that comes out from your brain and that acts on the ovary to produce estrogen and progesterone also. So when there's a derangement in this entire axis, functioning is deranged, that causes PCOS. And one more important component of PCOS is insulin resistance. So insulin is not a reproductive hormone per se. It is important for glucose metabolism.
Right.
When we talk about diabetes, we think about insulin.
Yes.
But yes, in PCOS, there is also this component, which is insulin resistance, which is common to PCOS and diabetes as well. Hence, PCOS also has this metabolic components where the patients are at risk of developing diabetes.
So, is PCOS reversible?
Sadly, it's not.
Okay.
So even PCOS, the treatment of PCOS is still being researched. That's what I tell my patients also. So we do give some hormonal pills to try to regularize the cycle. We emphasize a lot on a good diet and lifestyle. That is non-negotiable for PCOS patients.
Okay.
And then some new drugs are also coming up, which we do prescribe to patients. And with a good lifestyle and supportive therapy, a lot of patients do have a good cycle. Period cycle normalizes in a lot of patients. One more thing that is important for this PCOS patients is, PCOS is a diagnosis of exclusion. It is not the first diagnosis. Yes, it is the most common disease, but there are a lot of other hormonal disorders that can mimic PCOS.
Okay.
So we need to keep that in mind. And that is where the role of an endocrinologist comes in the management and diagnosis and management of PCOS.
All right. So it is not exclusive to obese women that they have PCOS. So women on the leaner side also can have PCOS.
So PCOS, as I said, it's not just about irregular periods.
Right.
PCOS has other components as well. There is a hormone called testosterone, which is the male hormone.
Yes.
So this testosterone excess is seen in females with PCOS.
Okay.
The ovary, it acts like a testis.
Okay.
So there is excess of androgens. Androgen means male hormones. Also, we have a gland called adrenal gland. This adrenal gland also produces androgens. So what happens in a proportion of PCOS patients, you will see facial hair, which is hard and male type of hair. It's not the soft hair that females usually have. Facial hair, body hair, the voice changes, there's excessive hair loss, and in a male pattern there is hair loss. So these are some of the features of excess of male hormone in PCOS. So in PCOS patients, the presentation differs. I mean, some may have excess of androgen excess features like acne and male pattern of hair, while some will have no hair at all on the face, completely clean and lean, and still they have irregular periods, and ultrasound shows polycystic ovaries.
Okay.
So the presentation is quite varied. So you cannot pinpoint, that there is a classic presentation, obese with acne, with increased hair. This is the classic presentation. But women who are lean, women who don't have features of androgen excess can also have PCOS. That's what I'm trying to say.
Okay. So is there any way to prevent PCOS from happening?
I think any disease, I just say one thing, I have one answer, is lifestyle and exercise.
Yeah.
But a lot, like 50-60 patients of PCOS are actually obese, and obesity can mimic PCOS. That is important. So there are certain conditions that can mimic PCOS. Obesity, also hypothyroidism. Then there's a hormone called prolactin.
Right.
So if prolactin increases, somehow there are some causes because of which
prolactin, as far as I know, is the
for milk secretion.
Yes.
So if prolactin increases due to some conditions like drugs or tumors that secrete prolactin, so there are some conditions that mimic PCOS. Some hormonal disorders, they mimic PCOS. So that's why we say PCOS is always a diagnosis of exclusion. So it's an endocrinologist's job to exclude the other diseases and then diagnose PCOS. PCOS, one important thing that I want all the audience to know, that androgen excess, like these changes, like male pattern of hair or voice change or balding in the male fashion. So these, if this happens within a short period, like 3 to 6 months or even less than 1 year, that is actually a warning sign. And they should immediately consult an endocrinologist for the same, because there are certain androgen secreting tumors or cancers which can present acutely like this. So the woman has all these features of excess testosterone in a very short span of time. PCOS usually takes a longer time to evolve and slow. But if it's very acute, then it's usually a warning sign.
Okay, now this is something I'm pretty sure that most of us did not know. Okay, so thank you so much for telling this. Can PCOS affect fertility in women?
Yes, PCOS does affect fertility because, as I said, polycystic. So the eggs or the ova, the quality of the eggs, it is affected. The size of the cysts are so huge, the ovum size becomes huge. So usually they have this ova or the egg, the quality is reduced, and they say the cycles in PCOS are anovulatory. That is the usually what happens. Normally the ovum is released in each cycle. So in PCOS, this is somehow hindered, so it doesn't
Okay.
happen. So fertility is actually a problem, but in most cases, more often than not, with a good lifestyle and some mild treatment, they do achieve a good fertility. It's
Okay.
not that all patients of PCOS will be infertile. That is a myth.
Okay. So, talking about the myths, what are actually the biggest myths around PCOS?
So if I have to number them, number one, that PCOS is only about irregular periods.
Okay.
That's one. Number two is that only obese women have PCOS. And third will be that women with PCOS are infertile. These are the
Okay.
three biggest myths.
Okay. So, women with PCOS can still bear children?
Yes, of course.
Okay.
Many have. I mean, there are so many women because of today, there's increased imaging and doctors are available. They're being diagnosed. There have been many women who don't even know that they have PCOS and they've been, they've born children, and it's not like they can't.
Can women who are on the leaner side, can they have insulin resistance?
Yes, they can have insulin resistance. That's what we see in lean PCOS.
Okay.
So, see, insulin resistance is commonly because of obesity. So, if you're obese and there's a lot of fat cells in your body, it doesn't allow insulin to work. That is
Okay.
what is called insulin resistance. Like, insulin resistance means insulin is trying to enter a room and the room is locked. So, that is insulin resistance. So, there are a lot of factors that cause insulin resistance. One of them is excess of fat. But also the other factors that come in play, that is what comes in play in lean PCOS, genetics or receptor changes. These can be seen in lean patients with PCOS. They have insulin resistance.
Are there any particular food items that can control the insulin spikes?
Yes, so if you take a lot of fibers in your diet or you take slow acting carbohydrates, so there are complex carbohydrates and there are short acting fast carbohydrates. So that is what we call the glycemic index of a food. So how much, if you take this much of maida or refined flour, it will cause a higher spike in your glucose and insulin than the same quantity of if you take an alternative flour like ragi or jowar, something that is alternative. So there is a difference between different food items and how they can increase or spike up your insulin. Increasing fibers and increasing complex carbohydrates, that will reduce these spikes.
Okay, so often we see women following certain trends, trends as in related to food, related to exercises to stay fit and healthy. So, is one of them is intermittent fasting. Okay, so I want to ask and I want to know that is it safe for women?
I am an advocate of intermittent fasting. So yes, it is safe. If there are few conditions where you cannot do intermittent fasting, like if you're pregnant or if you're breastfeeding or if you have, chronic illnesses like a liver disease or, kidney failure or lungs, asthma, COPD, any of the chronic illnesses, you should not do intermittent fasting. If you're a diabetic on medications or insulin, you should not do intermittent fasting without asking your endocrinologist. Otherwise, if you're healthy, more than 18 years old, and you have a good lifestyle, then you can definitely do intermittent fasting. One thing that I tell them is intermittent fasting means there's a fasting window and there's a eating window. There are people, what they do is they fast for 12 hours or 14 hours, but in the eating window, they eat all kinds of junk food. So that's also not, helpful. If you're intermittent fasting, you're giving your body a good rest to use up your glucose which is stored in the body. So that is very good. But also when you're eating or in the eating window, food should be healthy.
Why is diabetes common in younger women these days?
As I said, increase in obesity and lack of exercise and sedentary job. People are usually just sitting at their computer with a desk job or, there's very little exercise. Those are the most common causes, lifestyle and diet.
What are usually the early symptoms or signs that women often ignore, thinking that it's just normal or it's just fatigue?
So yes, increased lethargy and easy fatigability. But you should be able to, compare that I was able to do this. I was able to climb a flight of 2 stairs and now I'm feeling very tired by just climbing 1 flight of stairs. that is, you have to compare what you were able to do previously and now what is the situation. And a lot of women have calf pain, leg pain, excess hair loss. These are some of the mild or very subtle signs that you can feel that, yeah, something is actually wrong with me.
So, ma'am, is there any way that diabetes can affect pregnancy in any way?
Of course it can.
Okay.
I mean, women who are already diabetics and are planning pregnancy, we have a very strict control for them, strict cutoff. Only when they have the sugars in that control, we advise them to plan conception. So
Okay.
that's one important thing. And also, women who are not diabetics and they are pregnant, we check their sugar levels intermittently at first visit and also at a certain period, because diabetes in pregnancy is also common because of the
Okay.
hormonal changes in pregnancy. The patients who are not diabetics previously can develop diabetes during pregnancy, which is actually reversible after pregnancy. Though these women have a risk of developing diabetes in the future, and sadly, their offspring or their child also in the future, in their adulthood, has the risk of developing diabetes as well.
So, ma'am, there is another thing that thyroidism sometimes get induced because of pregnancy. Is that reversible or does that stay with them for the life?
Yes, women who have mild hypothyroidism before pregnancy or even don't have hypothyroidism, during pregnancy they may develop, and because of which we have to treat it, because again the fetus or the child in the in the pregnancy time depends on the mother for thyroid hormone. So
Okay.
we don't want any kind of deficit for the child. So we do treat them during pregnancy, and post pregnancy they recover.
Okay.
Many recover.
Okay. Ma'am, often when we see that women gain weight, why is it often seen in women that they have fat around their bellies when it comes to hormonal imbalances?
So hormonal imbalance is belly fat, or what we call in scientific terms central obesity.
Okay.
It is a sign of insulin resistance.
Okay.
So insulin resistance and excess cortisol, these are the two important reasons why belly fat increases.
Is calorie counting enough to stay healthy, to maintain a certain weight?
Yes, calorie counting is not enough. I mean, to maintain a certain weight, what you're eating is also important. For example, you'll think that my calorie content for today is 1400 kilocalories, and you include a full 6 slice pizza and one bottle of some cold drink. So that is also 1200 kilocalories, 1400 kilocalories. So calorie counting, more important than that is what you're eating. That is very important. And for obese people who are trying to lose weight, it is calorie deficit. But again, calorie deficit, but what calories you are taking, your intake is more important.
Okay. There are these things that the younger generation, not only women, but men, younger generation especially, follows about crash diets. So are they helpful in any way or are they actually harmful?
No, they're not helpful and they're harmful, in fact. So you must have seen your friends or your relatives, they have a wedding to attend in 10 days and they'll be searching for videos on YouTube, lose 10 kgs in 10 days. That is not normal and that doesn't happen. So that's absolutely, it's the name suggests, it's crash. So
Okay.
you should not do it. So always, weight loss should be a sustained weight loss. So
Right.
if you have a wedding in the family, you prepare from 3 months.
Okay.
Not 10 days. And crash diets, the faster you lose weight, the even faster you gain it back.
Okay.
There are girls who don't eat anything for the entire day and they have some juice or shake and detox diets or water diet. I don't know what diets, but that's not useful. For me, even my patients, I give them a very sustainable goal. At least 2.5 to 3 kgs per month. Per week, if you're losing 0.5 kg, that's also good enough. So we don't want 10 kgs in 10 days. And anybody who is saying that is actually lying. Please don't believe that person.
So, related to this, I want to ask you a very important question. Is that today's trend is that taking weight loss injections, medications, or any sort of drug that can induce the weight loss in people, not only women but men as well. So, how safe are these pills or the injections? Do they have any kind of long-term side effects on people?
So weight loss drugs, I would say for the right candidate, they are miracle drugs. Because 3 years back, when a patient who is a 120 kg female walked into my clinic asking me, ma'am, how do I lose weight? I did not have a good medication for that patient. I asked her for a diet, lifestyle and some mild medications that will help in weight loss. But now times have changed, that these drugs are very useful for these morbidly obese patients who have, diabetes, who have hypertension, who have arthritis, who are not able to move from the bed to the washroom. So these patients, earlier they had to undergo bariatric surgery, which is a weight loss surgery, or
Right.
certain extreme options for weight loss. Now these drugs are really good for these patients. It is not for patients, who want to, have a quick weight loss, or, want to look a certain way. It's not for them. These are medical drugs. So for the right indication, they are good. So all drugs have adverse effects. All drugs, any drug that you take has adverse effects. These drugs, long-term studies, of course, they have been under the radar for around 6 to 7 years. Till then, I don't think any life-threatening, side effects has been seen. A few cases of blindness have been reported worldwide, and some psychological distress has been also reported. But I think more and more, observation will only tell us what very long-term effects can be. But for patients who actually are in need of these drugs, these are miracle drugs for them.
Okay, so it is not for everyone. It is just for the people to whom their doctors have prescribed these.
Yes, there are very clear-cut indications for these drugs. Extremely clear, well-defined indications. And, whether it's a diabetic or, it can, some low doses are given in diabetes as well, for diabetes control in overweight or just obese patients. For patients who have, something that we call as metabolic fatty liver disease, metabolic steatotic disease, which we commonly know as fatty liver, which I think many patients in their ultrasound, they see grade 1 or grade 2 fatty liver. So for fatty liver also, these drugs have been used. For PCOS, especially if PCOS is associated with obesity, that is also useful, though it has not still been approved by FDA, but as a drug it has been tried. But mainly for obesity, diabetes, hypertension, these patients who have all these comorbidities along with obesity, they have been prescribed.
So, oftentimes, younger people, as usual, they often complain of sleep disorders, that I did not sleep well, I'm feeling lethargic, I'm feeling exhausted. How can lack of sleep disrupt hormones in people?
So we have something called the circadian rhythm. Okay, so that is, circadian rhythm means the change in hormones in 24 hours.
Okay.
When you get up in the morning, that is when you're active. That's what your body understands. Seeing light, sunlight, it understands that now is time for activity, and
Right.
accordingly it increases the hormones that are ready for your day-to-day activity, one of them being cortisol. So towards the evening, once the sun sets, the body's rhythm changes and it slows down. So it gets
Alright.
ready for sleep, it gets ready for rest. So if what we are doing now, people, they sleep late in night, they eat, have their dinner even at a later period, their minds are active on the phone, screen time is still there till later, even till they go to bed. So
Right.
because of this, your body's this entire rhythm is imbalanced, because you're giving light to the body when it
Okay.
is expecting darkness or rest.
Okay.
So your hormones, they respond to cues. So if your cues are not right, there will be, rhythm disturbances. So that's what happens. Nowadays, insomnia is so common.
Yes.
When you're telling your patients about stress is directly related to, lack of sleep. Lack of sleep is also again related to stress. So I think what we can do, key point, I tell my patients, at least by 9:30, phone should be away. A lot of people have night shifts, a lot of people have, late works. So for that, I think how to avoid that. Most people who can, they should keep phone aside and give their mind rest.
So, related to this is that many people now have jobs that they work during night.
Yes.
Yeah. So, how is staying up throughout the night and sleeping during the day, does that affect the hormones, and how does it affect women?
So what it does, your body, what I spoke about the rhythm, it reverses. So your
Okay.
cortisol increases during the time you're active, and when you're sleeping, it comes down. So
Okay.
you are deranging the body's metabolism in a way, and it takes, if you have sleepless night, at least one sleepless night, it takes your body around 3 to 4 days to regulate the cycle.
Okay.
So of course, long term night shift workers and late workers, for them long term it has an effect on hormones, and long term there is an increased risk of metabolic diseases.
Okay. So that's the same for the
Men,
same.
that's the same for men as well as women, and it also affects, in long term it also affects fertility, reproductive cycle, all of that is also affected.
Okay. How many hours of sleep is usually ideal?
There is no ideal number for, it is just personalized, but minimum of 7 to 8 hours is good enough.
Okay. What are the best stress reduction techniques that someone can administer in their life to help themselves to manage the stress or to control their hormones or to just be relaxed?
I'm so glad you asked this question. I've just been speaking about avoid stress, avoid stress. I think your, viewers will ask. She's
Yeah.
only asking to reduce stress. How to reduce
Yeah,
it?
how do we do it?
So I think most importantly, breathing techniques are very helpful. I
Okay.
tell this to my patients, especially those who just openly express to me that we are very stressed. So breathing techniques are very useful. So anything, nasal breathing techniques or other techniques which you can learn over time with help of the internet. So you can make good use of the internet as well. So
Yeah.
learning breathing techniques is very good. That's one. And second is, especially for patients who have impulse eating or impulse stress, for them, just get up from the seat and go for a walk. Or when you're sitting and you get anxious for something, name 5 things that you see around yourself.
Mhm.
Anything, or spot 5 colors. So distract your mind.
Mhm.
When especially for patients who have anxiety or impulse eating, someone who is trying to lose weight but wants that bag of chips, so at that moment, just do something else.
Yeah, I guess. I mean,
Divert
I relate
yourself.
to that.
Divert yourself. Everyone relates to that.
So, moving on to gut health and how they are related to hormones.
Yes, gut health is very much related to hormones. In fact, I was surprised. I had a patient who spoke to me for weight gain, and she told me, my gut brain axis is not working. I said, how did you know it's not working? Well, I can feel it. So of course, gut health is important. So for that, you need, your gut has a lot of bacteria, good bacteria and bad bacteria.
Right.
Science stems from this fact that a lot of diseases happen because of this dysbiosis or this imbalance between good bacteria and bad bacteria.
Mhm.
So what you can do from your side is try to increase the good bacteria by taking foods like fermented foods. We have a lot of fermented foods in our cuisine. So pakhada,
Yeah.
kanji. So all of this, and has Korean say kombucha.
Yeah.
So
Kimchi as well.
kimchi.
Yeah.
Yes. So a lot of fermented food helps in increasing dahi.
Right.
So increases your good bacteria.
So probiotics helps with PCOS?
Probiotics, as I said, see, dysbiosis is a cause of a lot of diseases. So I wouldn't say particularly PCOS, just name PCOS, but as a general well-being.
Okay. Okay. So, ma'am, often women experience bloating right before periods or during periods. So, is it related to digestive issues or is it related to hormones?
So yes, it is related to hormones because, as I said, menstrual cycle of 28 days or whatever your cycle is, it is an up and down of hormones. So there is a hormone called progesterone.
Right.
So this progesterone causes bloating, and there's this mid-cycle weight gain that you get,
Uh-huh.
1 or 2 kgs that you increase during your cycle. That is because of progesterone.
Okay. I would personally say that gluten, some other things, they're very fancy words for me personally, because I actually had a very
Normal
desi
childhood.
palate growing up in homes, right? Our moms feed us.
Everything.
So, yeah. So these things that the younger generation follows, gluten free, this free, that free. So how do they affect thyroidism or PCOS or anything?
So I heard this joke: gluten free, dairy free, vegan,
Oh, yes.
and taste free.
Oh my god. Yeah.
So yes, I mean, there's also a lot of buzz around this anti-inflammatory diet.
Mm-hmm.
So I think autoimmune diseases,
Mm-hmm.
so they stem from certain, some foods can exacerbate them or incite them. So for that, I think also some specific conditions are there, like we call it celiac disease,
Mm-hmm.
where it's a digestive gut issue that affects your entire system. That is sometimes associated with hypothyroidism, sometimes in some patients. So there are some patients, when they take milk, they're lactose intolerant. So when they take milk, they get bloating. So
Right.
there are some patients who, when they take gluten food, like refined flour or barley, these kind of foods, wheat, so they have bloating. So if you feel bloating when you take these foods, then you should definitely avoid them. So I think moderation is key in everything. So I wouldn't advocate that gluten-free diets you should follow. All hypothyroid patients should take gluten-free diet. I believe in a balanced diet. That's what is more important.
Okay. Ma'am, moving on further, menopause and perimenopause, all of these things are related to hormones. So, what is the difference between them?
So menopause is when your period stops for 12 months. One complete year, it is stopped. That means you have achieved menopause. And if after 1 year of your period stopping, if you get a spotting or any kind of bleeding, then that's abnormal. Okay. Anytime within, you have stopped periods for 4 months and then again you get some spot, that is normal in perimenopausal period. Perimenopausal is the 2 to 3 years prior to menopause. That is called the time around menopause is perimenopausal period. This is the time when your periods start getting more and more irregular, when you experience more and more mood swings, you feel tired, and then you get this hot flashes. That is a hot feeling over your face and chest and increased sweating. You feel extremely hot. Only those who have faced it can explain it what it is. It's like someone is throwing hot sand on your face, so it feels like that. Then loss of libido. So all of these are perimenopausal symptoms. And so menopause is when 1 year completely your periods have stopped. That is menopause. And usually in India, the common age is around 46 years. So anything around 46 years is normal.
Okay. So, are these hot flashes inevitable?
So yes, in most patients, it is very common, and not all patients face it for sure. But the patients who face it, for them, we have to treat it.
How does someone stay healthy enough to go through the transition of menopause?
Yes. So as you said very rightly, it's a transition period. From a fertile woman, you are now going to a stop of your periods. So a lot of mental changes are also there, physical changes are there, weakness is there. So it is definitely, a trying time for the woman. So one thing is very important is your balanced diet. Nutrition is important. Second is some degree of exercise. Not just, aerobic exercise or cycling and running. It is also important that you work on muscle building, because menopause is the time when you lose your bone health. Your hormones are low. Estrogen is important for your bone. So once it drops, and it drops quite starkly, it falls. So that is what leads to, a disruption in your bone health. It causes these hot flashes, mood swings. This fall in estrogen causes these symptoms. So a good diet, exercise, which is both aerobic as well as muscle building. Muscle building, just minor, you can take some weights or resistance bands, and also yoga. Yoga will help not just for, mental balance as well as flexibility and bodily balance. That is also important. That helps in, crossing this transition smoothly. Apart from that, I think calcium supplements are also important. Diet is not, sufficient in calcium. So calcium supplements are also important. And in some patients who experience extreme of menopausal symptoms, hot flashes or loss of libido, dryness of vagina is also very common. So they can, seek treatment for it, and we do have treatment for it. So that's important. And one more important thing is screening for your bone health. So we do a DEXA scan, bone mineral density scan. So you should consult your endocrinologist for at least they will assess your risk factors and advise you how frequently you need the DEXA scan. We don't want you to fall and break your hip and be bedridden for a long time. You must have seen a lot of patients, elderly patients, or postmenopausal women getting a hip fracture or a back fracture or this wrist fracture. This is very common in women, postmenopausal women.
Okay. So, ma'am, is hormone therapy a good substitute for this to deal with menopause? And another thing is that how the family or friends of a woman going through this transition can help them smoothen this process.
So I think for women, what happens is, because I told you they take most of the responsibilities and they don't take care of their health. So I think family support is very important, because mood swings are very common, anger and that is common. So family support, going for walk with your family or having a helping hand for the home responsibilities, that small things can help. So, and then hormone therapy, I think it is very specific. It's not for all the patients. It's for some patients who need it and who don't have other risk factors, because hormone therapy also has its own, pros and cons. So very carefully we have to choose whom to give hormone therapy.
Right. Thank you so much for your time, ma'am, for coming here today and teaching us so much about endocrinology and about hormones, how to keep us healthy. Before ending this session, I would like to ask you one last question. Is that when exactly do we see an endocrinologist? Do we see an endocrinologist like a regular checkup in 6 or 7 months? Or do we only go to an endocrinologist only when we are referred by another department of a doctor when we are facing other health issues?
So yes, that is the sad reality of core endocrinology, that a lot of my core real endocrine cases who are hormonal disorders are usually referred to me by my colleagues because they're able to pick it up. Patients don't have a lot of awareness about endocrine diseases.
Right.
Most commonly, I just want to tell what are the 4-5 diseases that are very common that we see regularly, and we are trained to see those diseases. Diabetes. So diabetes is the number one disease and that we see, and most of our patients are diabetics, and diabetes is a disease that is seen by an endocrinologist. Thyroid disorders, so if you have a deranged thyroid function test, you should consult an endo. Hormonal disorders, reproduction, for example, irregular periods or early periods in children, or late periods, delayed puberty, short stature, if your height is not increasing, child's height is not increasing, excessive weight gain, recurrent bone fractures, and recurrent urinary stones. So these are some of the common conditions that we see. Apart from that, prolactin, as we talked about prolactin, that is a hormone which is important in fertility. If prolactin is high, that is also what an endocrinologist should see. And pituitary, parathyroid, adrenal, so there are many endocrine organs. So diseases related to these organs are what an endocrinologist should see. So a regular checkup with an endocrinologist is needed when you do feel that you are suffering from some hormonal changes in your body. You can definitely consult an endocrinologist for the same.
Thank you so much, ma'am. Thank you for your time. Thank you, viewers, for your time. I'm sure you got to learn a lot about hormones, your health, and how to stay healthy by Dr. Sweekruti Jena. Thank you so much, ma'am. Stay tuned for more episodes on OTV English podcast.